So have a quick stop here to answer another possible question that might be asked in a pharmacology exam. So this is known as what? Pharmacology of Fluoroquinolones. Alright, Pharmacology of Fluoroquinolones. So for these fluoroquinolones, anytime they ask you to talk about a classification of drugs, there's a way you approach the question. So you always give an outline so that the marker will read this outline and what settle down to be entertained. Do you understand? You make them know what they are expecting. So we'll give the introduction of fluoroquinolones, we'll give the examples, give the pharmacokinetics, mechanism of action, side effects, contraindications, that's when you shouldn't use these drugs, the interaction. Okay, so these are examples of some fluoroquinolones, right? With the second generation being the ones that are still surviving right now. Okay, you can recognize some there. So fluoroquinolones on an introduction, we said that they are fluorinated nalidixic acids. Okay, examples of fluoroquinolones include ciprofloxacin, ufloxacin, levofloxacin, norfloxacin, moxifloxacin, gasifloxacin, lomifloxacin, enoxacin. Do you understand? Just continuous like that. But these other ones have been withdrawn. Alright, these ones too, they are like the parent. Okay, so now I have to actually confirm if it is nalidixic or naldixic. Okay, it's nalidixic, right? It's nalidixic. So let's move. Pharmacokinetics. We said that they are fluorinated analogs of nalidixic acid. They are well absorbed orally with the serum concentration. They are not similar to those of other drugs of what? Intravenous routes. So their half-life is about approximately 7.5 hours. So the range is 3 to 10 hours, right? Excretion is via renal route. Cross-resistance is common. They are active against what? Gram-negative and gram-positive bacteria. So this is like a general structure of what? Fluoroquinolones. It's a general structure. If you draw it to your examiner, I will be happy with you. So, mechanism of action. They inhibit two enzymes that are important in DNA replication. Okay, so DNA gyrase is also known as topoisomerase 2. Then they also inhibit topoisomerase 4. Do you understand? So for the DNA gyrase, there is an enzyme that produces what? Relaxation. That's increased flexibility of RNA-induced what? Positive supercoil. Then if it brings relaxation, also introduce what? Negative supercoil. That's mostly seen in gram negative bacteria. Then in inhibiting topoisomerase 4, it is important in the process of what? Segregation of what? Newly replicated chromosomal DNA. We are talking about the importance of the enzymes that the fluoroquinolones inhibit now, right? So topoisomerase 4 is important in the segregation of newly replicated chromosomal DNA daughter cells. Alright, so that means if you inhibit topoisomerase 4, the segregation of newly replicated chromosomal daughter cells are no longer there. Are you getting the gist now? So here are some examples again, looking at their brand pictures and looking at their what? Biochemical structures. A nice page which you can actually pause at to look. So therapeutic indications now. They are effective in treating what? Urinary tract infections, except moxifloxacin. Alright. Also used in treating enteritis, used in treating gonorrhea, chancroid, soft tissue infection. The second line of treatment in tuberculosis and what? Bacterial endocarditis. They are used in treating bone infection. They are used in treating gram-negative septicemia. They are used in treating upper and lower respiratory tract infections. Mechanism of resistance. Like, why would these drugs, why will organisms suddenly develop a resistance to this drug? It could be due to chromosomal mutation producing alteration in the target. It could be due to decreased permeability. The organism is no longer taking the drug in. Then it could be due to what? Efflux. It could be that the drug is actually getting into the organism, but the organism is also shooting it out. You understand? Side effects of this drug could be classified via the various systems that we have: GIT, nausea, vomiting, and anorexia. CNS is dizziness, headache, anxiety, impairment, lack of concentration, and tumor. Okay, I think this is humor, right? All right, this should be humor. CVS is prolonged of QT interval. You have hypersensitivity reactions like skin rash, pruritus, swelling of the lips, photosensitivity. Connective tissue damage, mostly seen in patients less than 18 years. Tendinitis can also be seen in adults. So contraindications. When you shouldn't use this drug, you shouldn't use it in combination with what? Class 1 antiarrhythmics like quinidine, procainamide. Class 2 antiarrhythmics like amiodarone, sotalol. You shouldn't use it with tricyclic antidepressant like nortriptyline and what? Imipramine. You shouldn't use it together with erythromycin. So that's the whole thing on the pharmacology of fluoroquinolones.